Hi, I'm Dr. John Lenahan. I'm an OB-GYN physician in Seattle, Washington, and currently working with mimic simulation. And I'm interviewing today Dr. Sloane Guy. Sloane Guy is a cardiothoracic surgeon who's in Jefferson Medical Center at Philadelphia. And he is sheltering in place in Philadelphia, just like I am in Seattle. Dr. Guy, how are you doing today?
Good afternoon. How are you, John? Thank you for having me.
Good. So the reason that we're having this discussion is with this new COVID-19 situation, all of us busy robotic surgeons have had to stop our elective surgeries and are becoming rusty and losing some of our skills, as we know. So how are you dealing with this in Philadelphia? First of all, where are you at right now?
So I'm actually in my apartment downtown Philadelphia, about a half a mile from Jefferson Hospital where I work at Thomas Jefferson University. I'm actually in my kitchen at the moment.
Okay. So how has this affected your robotic surgery program as far as you're being stuck at home?
Sure. So, like most facilities, we stopped doing uh, purely elective surgeries maybe a couple of weeks ago, 2 or 3 weeks ago, because of the perceived, onslaught of COVID-19 patients and to protect resources. And, unfortunately, most robotic cases would fall into that category. Not all. There are exceptions, but in cardiac surgery, most of them would be considered to be elective, same-day admission, where the patient comes in from home to the hospital. So we stopped doing those cases as of that point. There are some emergencies that we would do should they arise,
Mhm.
like an infected heart valve or something, but we haven't had any of those thus far. So, there was some concern on my part about maintaining or even going beyond maintaining, but developing robotic skills even beyond my current skill set. And I speak as a surgeon that's done over 1,000 robotic cardiac surgeries. I think there's still some things that I can learn. And so we actually worked with your company to get a simulator installed into my apartment, and I've found it quite enjoyable. And basically, once a day, I'm doing a module, either one, sometimes two, until I reach proficiency, which is hopefully soon. And the curriculum was part of the machine, but there's a variety of different modules you can use. And so I worked with one of your partners to develop a specific curriculum. It's called the Dr. Guy COVID-19 robotic curriculum. And so there's a specific set of modules, and I'm almost done with those. And it's only been a couple of
Great.
weeks. Okay, so basically, this came in a package, and I can show you that package. But it's a box with wheels on it, and my folks downstairs were able to wheel it up to my room. I wheeled it in here, opened it up, and really with minimal to no instruction, I was able to unfold it, lower this armrest here. I don't know if you can see, there's these foot pedals
The
down
pedals,
here
yeah.
that which are the same as the XI, which is what I use, and then open up the screen. And
So
it
this is
comes with
set up
this
as
nice.
this is set up as an XI robot for you.
Yes, correct. I use exclusively the XI, and this is a Bluetooth keyboard, which is attached to what is essentially a computer. And so basically, when I go in, I log in, and what happened is, uh, since obviously a technician from your company could not come out, they did a Zoom call with me, just as you and I are doing, and they walked me through the process of creating an account on this computer, and then walked me through the process of creating, a curriculum, that was appropriate for my level of experience, that would, challenge me. And there were a lot of different options there that I liked, like the number of times you have to pass consecutively, the total number of times, and then I also expressed to him that one of the things that I thought that other specialties do better than robotic cardiac surgeons is clutch much more frequently. And so I expressed certain desires that I not only wanted to maintain my skill, but I wanted to advance my skill. And so I mentioned these to your fella, and he basically helped me design a curriculum designed to improve those particular points that I was looking for.
Good, good. So you're
I can't tell you that.
Using the slowdown as an opportunity to not only maintain skills, but to increase your skills.
That's correct. And I even though I'm a heart surgeon, I can't say that I haven't been tempted and done a couple of the urology procedures on this device, just because it was interesting to me.
I hear you.
And of course, I'm a general surgeon by background, so I can relate to some of that.
You see any role for this for people returning to the OR after a long time out, as far as recertification or?
Yeah, I think the of course, there's a lot of elements to being able to conduct surgery properly. Use of the robotic device is one of them. I've been using a Da Vinci since 2002. So I have a lot of experience with all the various models that have come through. But yeah, you get a little rusty. And I think there would be value to doing, between 1 and 4 modules maybe before you start back in the operating room. I think it's more than just, checking a box or making the administrator happy. I think that there might be some actual value to it. And I think for surgeons that are less experienced, it might be actually critically important.
Right. We've seen some data from, I know you were an Army surgeon and deployed, and that Army surgeons coming back were all rusty, but the ones who had the most experience could get back up to speed faster than the ones who had less experience. It took longer to get back to their normal skill set.
Yeah, that's true. And the other thing I like about the simulator is that, quite honestly, it's more difficult than an actual live case, because the standards of performance are quite high for the machine. I mean,
right.
You can so for instance, I don't know if you can see the screen, but there's a wound closure horizontal, which is as easy as pie for me. I do it all the time in the operating room, but I failed it the first time because I took too long. I'm like, what do you mean? I'm a heart surgeon. I'm supposed to be fast. But the computer doesn't lie. It tells you that you didn't meet the standard, and so then I plugged away and obviously passed it. But,
well, it does force you to meet that standard. I mean, we all take shortcuts in the OR, I know, but you get away with them most of the time. But this forces you to do it the right way. What kind of advice would you give to other surgeons who are all going through this shutdown, as far as how they can, if they don't have the luxury of having a simulator in their own apartment, how they can maintain their skills or get ready to come back when the gates open again?
Well, I think it's, without a simulator, that's going to be difficult to do. I think the era of COVID-19 has challenged us all. And I think all of us physicians have had to find ways to remain relevant, during the crisis. It's a different time than the usual state of business. I think, for one, you got to keep in touch with your patients, the ones that you're going to put off, and keep them informed about what you're doing, why you're doing it, that you're doing it for their safety. Sometimes you're doing it, it's not your choice. It's because of resource limitations or rules from governors and administrators, et cetera. But it's all designed for their safety. I think that we all take on different hats. For me, I'm basically the task force representative for the cardiac service line for cardiology and cardiac surgery for COVID preparedness. And so I'm quite busy in meetings every day preparing for that. And I suspect a lot of surgeons are doing things that are not in their normal spectrum, maybe ICU care or emergency room care or things of that nature. And so we've all got to do that, but we've also got to keep an eye on our practices and what this is going to mean down the road when we reopen our robotic practices, which we hope will be sometime within a month or two. We don't know that. I would say that if a surgeon does not have a simulator in their apartment, a lot of places do have simulators in the hospital. And Mimic has a backpack simulator that they built with Intuitive. Perhaps they could use that. One of the impediments to using that is often the machine's being used for live cases, but there are a lot fewer cases now, and so maybe they'll have access to it, or they have a Mimic simulator in their facility, or work with your company and get one in your apartment. I've sort of made it very clear on social media that I found this to be a positive thing, and I've had a number of surgeons of different specialties contacting me, asking me, how could I get one of those in my house or apartment.
All right. Well, they could reach out to Mimic in Seattle, and we'd be happy to work with them, just like we're working with you. And we appreciate you doing this today and sharing with us your knowledge and information. These are very trying times, and I think the more that we as surgeons kind of get together and share how we're coping with all this, the easier it's going to be for all of us.
Yeah, well, I think your technology is fantastic, and it's something that is a very necessary part of maintaining and building, a robotic skill set. And simulation is, I think, not only the present, but definitely the future of robotic surgery. And I think that that it's here to stay, and it's only going to get more and more sophisticated, just like it is for pilots. I used to be a pilot as well, and we used a simulator to train to fly airplanes, and this is no different.
Yep, that's my experience too. I have the same background, so I agree with you 100%. Well, anyway, thank you very
Wonderful.
much, Sloane. We appreciate the time today. I'm going to end this. And again, if anybody watching this has any further information, they can contact us at Mimic, and we'll get you in touch with Dr. Guy. Or if you're interested in having simulation available, we can help with that too. Again, thank you very much for your time today. Appreciate it.
Great, no problem.